The first 6 weeks with your baby. Why is the baby so small? Didn't feel that small coming out. There's some false advertising in those pamphlets. Is he ever gonna sleep? What is sleep? I used to do this by choice in college. If I sleep, I'll miss something. Is he sleeping? He's sleeping. Is he breathing? Maybe I should sleep. He's awake. No, that was him. Was it him? You said 1 cup? How do people survive? 1 cup? Am I thirsty? No, I'm hungry. My baby's in what percentile? What does that even mean? I'm hearing things. Doctor's visits. Man, that's a lot. Breastfeeding. Hold him like what? Underarm? Wait. Football hold? Try what hold? I don't play sports. How do I know that I'm doing a good job?
So if you're enjoying your child, you like spending time with your child, pretty much you are doing a good job.
What are some things that we could expect in terms of eating and sleeping?
Biggest thing to expect is lots of rapid changes. Most babies don't get a good sleep and day and night routine until after 2 months of life. Also expect that sometimes there'll be good days and bad days, just like you and I have good days and bad days. When they're fussy for a prolonged period, that more than a day, that we get concerned about, could there be something wrong?
So with the lack of sleep as a new parent, my first natural instinct is to go to drink caffeine and have coffee. Is that okay when you are nursing?
Generally, 1 cup of coffee in the morning is perfectly fine. And then after that, if you're going to have more caffeine, try to do it with non-coffee things. Try to completely avoid caffeine after 4 p.m. though, because we do know that caffeine gets through the breast milk, and just like it may keep you up at night, it can keep your baby up at night too.
So how would you advise a parent to kind of get through that process?
Right. So that's the hard part. So you have to think about things you do every day to give yourself energy. So go ahead and put the baby in a stroller when you feel super tired in the afternoon and go for a walk. Vitamin D on your skin for 30 minutes will release endorphins and improve your mood and give you some energy back. And then make sure you're drinking enough water. Also taking your vitamin, your prenatal vitamin, along with extra vitamin D. So you want your vitamin D to be somewhere between 4,000 to 6,000 units a day if you're nursing.
Why would you say breastfeeding is so hard for some and not for others?
Breastfeeding can be super, super painful for some moms. Generally, a baby will have to suck the nipple back an inch to get it into the right position of the palate. And that stretching when you first start nursing is really hard for about a minute or two. By day 5 of life for your baby, the milk comes in and it's flowing better, and the baby's not having to suck quite so vigorously. And at that point, the nipple pain lets up. So if you can get through those first 7 days, you will start to feel some relief. If you don't, then it's time to think about how your baby's latching. Now, if you get to 2 weeks and you're still struggling with making milk or latching, if you feel like you're still enjoying your baby, we can support you and keep at it. If you feel like it's becoming a hindrance and you're not enjoying your baby, it may be time to either supplement, alternate bottle and breast, or even just to go to bottle. And that is perfectly okay, because a baby needs a good attachment with their parent more than breastfeeding.
If you are breastfeeding and you become successful with it, are there any foods to avoid?
You definitely want to avoid alcohol. Alcohol does get through the breast milk, and it can have impacts on your baby's cognitive development, so IQ later down the road. That brain is still really developing rapidly until about 5 years old. Watch your milk and your soy intake. So milk and soy are 2 of the most common irritants that get through the breast milk and can cause a baby to get really fussy around 3 to 4 weeks of life.
When it comes to like colicking or like reflux. Does that have anything to do with the food consumption that you're having if you're breastfeeding?
If you have a baby who's super fussy in the evening time, but is happy all the rest of the time, that generally will be colic. It doesn't really seem to correlate with the mom's diet. That seems to be more of a neurodevelopmental thing that babies go through, eliminating a lot of extra loud noises. So if you go out to eat at a restaurant, your baby may sleep fantastic while you're there because it's really loud, but then you may have a really terrible night because it was like sensory overload for your baby. And then probiotics have been shown to help with colic. Reflux is different. Those babies may or may not throw up a lot, but they'll be super fussy pretty much 24/7. That can be due to milk protein sensitivity. The first thing is reach out to your doctor, bring your baby in for a visit to check to be sure there's not an infection or something more serious. Try changing your diet, eliminating the soy and the milk. If your baby's a month old, try the probiotic. You can try gas drops like Milacon to help your baby burp a little bit better. And if all else fails, especially if your baby's not gaining weight well or starting to cough a lot, starting to arch their back and get stiff as a board when they're nursing, generally we use a little bit of medicine to bring the acid down for those babies, and they feel dramatically better in just a couple of days.
What are some red flags you should watch out for?
Yellow or green colored vomiting that looks like a bright yellow highlighter is always in need of some urgent attention. Also, fever for a newborn, 100.4 within those first 2 months of life, we need to see right away.
Must-have baby items you recommend.
Saline drops are really great. Babies come out with stuffy noses. They have little membranes in there that they got from the amniotic fluid. Put 5 drops in each side of the nose a few times a day if your baby sounds like they're snoring like you can suction it out with the nose Frida, or you can just let the drops go in and your baby might sneeze them out or even kind of swallow it down. And then Milacon or little Tummy's simethicone drops are super helpful if your baby doesn't burp well, and it'll help get rid of the gas that's swallowed. The vitamin D. So a nursing mom can either take 4,000 to 6,000 units of vitamin D to enrich her milk, and baby will get 400 units. Or if you're not taking the vitamin D, you can give baby vitamin D through D drops, swaddle blanket. So it's best to swaddle your baby until 2 months of life. And then I also like a pacifier by a month of life, because there will be times that other people need to help you out with your baby. And if you can just allow them to use a pacifier, they'll have a much better technique since they can't breastfeed the baby for you to calm them down. Diaper cream, zinc oxide based, is the best for babies' bum. Babies poop so much during the first month of life, and those stools will irritate the skin. So just go ahead and use the cream liberally, even if you don't see rash during that first month of life. Do these gel pads that first 7 days when it's so painful. If you put those on, they just give you some immediate relief from that burning sensation.
The crib bumpers.
They should just not sell them because your baby will start to roll anywhere between 2 to 4 months of life. And when they roll over, if it's on a flat crib surface without any padding, they'll be fine. You won't have to roll them back over. But if there's those thick pads on the bumpers, they actually can scooch their way and get caught up in those and suffocate. So there are known deaths just from fluffy stuff in the crib, like crib bumpers. The mesh breathable crib bumpers are perfectly fine. The other thing to watch out for is mosquito netting. A lot of people put decorative mosquito netting around the crib. It looks beautiful, and you have to watch out for things dangling that they could pull into the crib.
What do the percentiles mean exactly?
We use the WHO chart. Some people use the American growth chart. What we're looking for is, does your baby follow his curve or her curve? So she is at 3%. That actually may be perfectly fine for her if every time she comes in, she follows the 3% curve and you're a little person yourself. Where we get concerned is when babies dramatically drop on weight. They're just burning too many calories, not absorbing them right, or just not consuming enough calories.
Overall, what advice would you give to a new parent?
Plan on maternity time is time for you to help your baby adjust to this world and time for you to rest as much as you can. My name's Janet Pate. I'm a pediatrician in Houston. I finished residency program in 2004 from Baylor College of Medicine and Texas Children's Hospital, and I've been practicing here in Houston since that time. I'm the owner and chief physician at Nurture Pediatrics, and I love what I do. It's fun, and talking with new families is one of my great joys.